Hey guys, this lecture is going to provide an overview of just some really basic information related to growth and development. And this information is really important because a lot of times our very first clue that a child might be having a problem is that they aren't meeting those milestones that we would be expecting them to. And so to pick up on these delays, you kind of just have to know what you're looking for in the first place. So what we're going to do is we're going to talk about some different patterns and cover basic terminology that relates to this. And guys, I'll be the first to admit that some of the terms that we're going to cover here, they're just not things that you use on a daily basis, but they are super, super testable. And they do help with understanding of the big picture when it comes to peds nursing. So let's get started. Okay, so let's think big picture. A child's development happens and occurs because of an interaction between genetics and environment. And if that development isn't happening like we would expect it to, we have to figure out why. And so what we're going to do is we're going to ask questions about family history, and then we're going to really explore their environment. So key factors that we're looking for in the environment are going to be nutrition, play, sleep, stress, illness, injury. All of those factors can really, really impact a child's ability to meet those milestones and grow like we want them to. So let's just take a second to look at some examples of how this might play out. Okay, so these three examples you see here represent some of the really common ways that delays or problems can present. So you could have an infant, a 3-month-old maybe, that isn't developing head control like we would expect them to, so they've got poor tone. Or you could have a toddler or a preschooler that's not having their speech develop like we would expect them to, and maybe this is affecting the way they're playing with those around them. You could have a school-age kid that's losing weight and has low energy. All of these represent different ways that kids can have delays in their growth and development. So these are just some really basic examples, but what I want you to do is check out the age-specific developmental lessons that we have for you, and they're going to go through each phase of development. So infants, toddlers, preschoolers, school-age kids, and adolescents, and they're going to highlight those different clues that you should be looking for and how that impacts your nursing. Okay, let's get into some of that terminology that I mentioned earlier. So growth and development follows a few general patterns, and if you can learn these, they will really help you as you're thinking about what should be happening and keep you from having to just memorize those milestones. So you can actually sort of think through it and process it rather than just committing a list to memory. So the first thing to know is when we talk about childhood development, these milestones that they're going to be meeting are going to occur in a cephalocaudal pattern. And this just simply means that they're going to happen from the head down. Okay, so example of this would just really simply be that an infant has to get control of their head and neck before they can do something more complicated like sit up and walk. The second pattern is that it occurs from the center outward, or proximodistal. And this simply means that core control and that core strength happens before milestones involving the extremities. So again, sitting before crawling, crawling before walking. The last pattern to know is that skills develop from general to specific. A really great example of this is the way that babies learn to use their hands. So first, they get what we call palmar grasp, and then they move on to be able to use those individual fingers in what we call a pincer grasp. So first they can grab a rattle, and then next they move on to being able to grab a Cheerio or a pea or something like that. So general to specific. Okay, so now that we've talked about some of those patterns, let's sort of specifically look at how we measure growth. And this is pretty straightforward. So the three things that we're measuring are weight, length or height, and head circumference. And these things, the most important thing from a nursing point of view is to always ensure that there's consistency and accuracy. So any equipment or tools that you're using need to be calibrated and use the same across all the children that you're seeing. So weight is going to always be measured in kilograms. And for length and height, the main difference to know is that if they're less than 2 years, we're going to be measuring their length, and we do that with the child lying down. If they're greater than 2 years and can follow instructions, we're measuring their height, and we just do that standing up like you would with anybody. Head circumference is measured up until the child is about 3 years old, And this is because this is the period of time when their brain is developing and growing the fastest. So from birth to 36 months is when we track that head growth. Results for these things should be documented on a growth chart. And even though this can look really complicated, like there's tons going on there, all that a growth chart is really telling you is out of 100 kids where this particular child would fall. So if you're explaining this to a parent, you would just say, right, little Johnny, he measured at the 99th percentile. And all that means, mom and dad, is that in a room full of 100 kids, he would be taller than 99 of them. And so that's just a really simple way to think about explaining it. And what we're looking for in terms of weight and height is that they're sort of comparable. So if little Johnny is 99th percentile for height, we would sort of expect him to be the same or close to the same for his weight. Okay, so we've talked about growth. Now let's move on to just quickly highlight some major things about assessing development. So I've listed here some major facts and concepts, and we're just going to chat through these different things. So first thing to know is you've got to know what the different stages are. So when we say stages of development, we mean neonates, infants, toddlers, preschoolers, school-age kids, and adolescents. If you take a look at the outline, I've listed there for you the exact ages for each of these groups. The next thing to make sure you know are your theories. So your developmental theories are covered in your fundamentals course. So take a look at that for sure. The two that are most relevant to peds are Erickson's, which is all about psychosocial development, and Piaget's, which is all about cognitive development. So you've heard me say the word milestones 100 times already. And all we mean by that is that those are the specific activities that we're looking for a child to do at a certain age. And we look at these in different categories. So you've got motor development, language development, psychosocial, and cognitive. The major thing to know about milestones is that anytime we're assessing a milestone, we're talking about the mean or the average time that a child would be doing this. Every single kid is going to be a little bit different in the way that they approach it, but the milestones are looking at the average. So if we do have a delay or a move from what we consider average, we talk about that in terms of delays and regressions. A delay simply means that they don't accomplish it when we've expected them to. A regression is a little bit different because a regression means that they have previously been able to do that skill, but now they are no longer able to do that. And this is really important to note because usually if there's a regression, that means there's some kind of active disease process going on, and we have to pay close attention to that and figure out why. For example, a child with a tumor may suddenly have a change in their coordination. And again, that's different from a delay, so we have to pay really close attention to that. Okay, guys, that finishes up our quick overview of pediatric growth and development. Your priority nursing concepts for this lesson are human development, patient-centered care, and health promotion. Okay, guys, I hope you found this lesson helpful as a review of growth and development. Your key points for this lesson are, number one, think of growth and development as clues. If you see that there's a problem, a delay, or a regression, ask why and assess. And also remember, they're not just clues for practice, but they are excellent clues for test questions as well. Number two, you got to know those milestones so that you can spot delays and help that kid. And finally, be familiar with terms and theories. Again, it's not the most fun thing to learn, but like I said, very, very testable. Okay, just a reminder, now that we've covered this content, we do have those other lessons that are specific for each age group, and these go into great detail and give you more clues for each of those phases, and they'll also give you tips for how this impacts your nursing care. Okay, guys, that's it for this lesson. One last quick tip I thought of. If you haven't spent a lot of time around kids and you feel a little bit overwhelmed by trying to grasp this timeline of development from birth, especially to 5 years, one of the best things you can do is go to YouTube and look up growth and development of the different stages. There are a lot of really great videos that will give context to all of this and help you visualize and really see what we're talking about. I've attached a couple to this lesson actually, so you can start by looking at those. But I think you'll find those really helpful. Now, guys, go out and be your best self today, and happy nursing.